Good afternoon and welcome to the fourth session of our 2024 Justice Center Summit. So we will begin with the updates and we're going to start with, it's my pleasure to introduce to you our new Acting Executive Director, Maria Lisi Murray, who would like to say a few words.
Good afternoon, everyone. My name is Maria Lisi Murray. It's my pleasure to be here with all of you this afternoon. This is my first time attending the Justice Center Summit. So if you're new to this, you're not alone. I am looking forward to these in-depth presentations and to hearing your feedback. With that, I wanted to take just a few minutes to introduce myself and provide a little bit of my background. For those of you who don't know, I was recently named Acting Executive Director after former Executive Director Denise Miranda was asked to lead the Division of Human Rights. Prior to this appointment, I served the agency as a Deputy Director for Internal Audit, Internal Controls, Quality Management, and I oversaw the team of attorneys that reviewed appeals when they were first filed at the agency. I came to the Justice Center from DMV, where I was their Chief Risk Officer. Again, I oversaw internal controls, internal audit, the Office of Risk Management, and the Office of Compliance Counsel. I'm an attorney who previously worked as an assistant attorney general, and I am a former police officer investigator who served with the city of Binghamton in New York. When I joined the Justice Center last year, I was immediately impressed with the agency and its staff. A recent Justice Center workforce profile shows roughly half of the staff here either have a family member with special needs or have worked as a direct care professional. I tell you this so that you know our staff understands the challenges that you may be facing because it is their lived experience. We work in partnership with families and providers to ensure the best care possible for people under Justice Center jurisdiction. And I'm excited to be leading this agency as we look forward to the second decade of operations and beyond. Former Executive Director Miranda established a strong foundation, and I intend to build upon that legacy and continue to strengthen the protections we provide to people with special needs across New York State. I look forward to your partnership in that mission. And with that, I'll turn it over to Rob.
Hello, everyone. My name is Rob Miller. I'm the Executive Deputy Director at the Justice Center. I just wanted to say it is fantastic being here with everybody, even though virtually I can't see anyone, but you can all see me. So I really appreciate this opportunity to communicate some of the updates for our agency this year. So with that, let's get into it. Our first off, you see our vision statement on the screen. This is the statement that guides our work. We know that protection of individuals with special needs is a shared mission, and we rely on the dedicated workforce working in our programs and for our providers every day to do our work. The dedicated workforce that we see every day, each year we seek nominations for our Code of Conduct Award. This is a great, easy, and free way to recognize, all of the great people and the dedicated staff that are working day to day, to provide critical services. Everyone who is nominated receives some form of recognition from the Justice Center. The Justice Center will present award winners by traveling to their workplace and presenting them their award in person. Next, we have some statistics and trends that we want to, some data that we would like to share with you. We know that we publish data about our work on our website with a monthly report that anybody can go and read. We also publish data on the state's data website, Open Data NY. In terms of reports made to the agency in 2023, we had roughly 85,000 total reports to our Vulnerable Person Central Registry or intake unit. Sometimes there are multiple reports associated with the same incident. Abuse and neglect, significant incidents and deaths in residential programs operated or licensed by the Office for People with Developmental Disabilities, Office of Mental Health, Office of Substance Abuse Services, and Office of Children and Family Services are all reportable to the Justice Center. Reports that don't rise to the level of an incident or occur in a setting outside of Justice Center jurisdiction, for example, nursing homes, they are referred, to the appropriate state oversight entity for follow-up as needed. Next, we have a breakdown of substantiated cases by category level at the Justice Center. For reference, approximately 1/3 of our cases that we investigate are substantiated for abuse or neglect. That percentage has held very consistent for the 10.5 years or so, almost 11 at this point that we've been in operation. A case is substantiated when there is a preponderance of evidence that supports that determination. Preponderance standard means more likely than not that the incident occurred. Once a legal determination is made that an allegation is substantiated, a category level is assigned based on severity. Category 1 is generally defined as serious physical abuse, sexual abuse, or other serious conduct by staff. To note on that, a Category 1 determination will result in an individual being placed on the staff exclusion list, which bars direct contact work of that individual for the rest of their career. Category 2 is defined as conduct where staff seriously endangers the health, safety, or welfare of an individual. By committing an act of abuse or neglect, failing to seek timely medical care if a person receiving care suffers a broken bone, or texting while driving, are examples of Category 2 findings. Category 3 is our most frequent determination. It's used for cases where abuse or neglect occurred, but harm was not as serious as that of a Category 1 or Category 2 finding. All findings of Category 1, 2, and 3 are findings against individuals working in the system. Category 4 findings are made against a provider agency when the conditions at the program exposes individuals receiving services to harm or risk of harm, but where individual staff culpability is mitigated by systemic issues such as inadequate staffing, which I'm sure many are familiar with at this point, management, training or supervision issues. It also applies when there's been a finding against an individual, but that person cannot be identified. We have a quick comparison of state operated versus voluntary agency findings. You'll see neglect is the largest percentage of our findings. Almost 9 out of 10 substantiations are neglect, with physical abuse being the second one. As you can see, while there are minor differences, between the categories at the state operated and non-state operated, they're very consistent with each other. So in this next section on updates that we have, we'll talk about some changes made in the past year and new resources that are available, for all to take advantage of. In terms of provider outreach, last year in 2023, the Justice Center held 5 incident management roundtables with 5 of the state oversight agencies that we work with between March and June of last year. These are great small group discussions, which provide an opportunity for the Justice Center to receive feedback and also, connect with staff at provider agencies and, those who do the work. Participants discussed how to assist provider agencies in spreading awareness of the protections afforded to their loved ones in care and creating processes that ensure families receive timely notification of incidents of abuse and neglect. Overall feedback, about the Justice Center's ability to respond to concerns and operational needs of provider agencies was very positive. and we really value that feedback. The Justice Center is working with state agency partners to address, the concerns that were raised during these roundtables. A couple of examples here. We established a work group with the Office Prevention of People with Developmental Disabilities to develop resources for agencies to help families understand the incident management process. The goal of the work is to guide providers on effective communication and a guide for families on effective advocacy. Work of the group is also focusing on eliminating redundancies in reporting and corrective action plan audits. Also, we changed the online reporting form for reporting incidents to make it easier and simpler for people to use so we can receive reports. Our next, next thing we want to make you aware about was family notification. After meeting with many family groups, it was clear to us we needed to take some additional action, and we took steps to ensure that families are notified by the Justice Center at the beginning of every Justice Center led investigation. This allows our investigators to learn from family members about best, most effective ways to communicate with their loved one who is in care. This also gives the Justice Center an opportunity to refer families to our individual and family support unit. Our IFSU unit, that is our acronym for that. But our individual and family support team is a fantastic group. They do great work here. The unit helps families obtain information they are entitled to under the law, explain the investigative process and outcomes, and just generally assist families with any questions they may have. The folks that work over in that unit are extremely dedicated, and they take pride in the help that they give families and individuals every day. Second thing that we want to make you aware of is telehealth videos. After COVID, we recognize that expansion of telehealth services, and how beneficial they can be for individuals with disabilities to easily access healthcare. Justice Center produced a series of videos to help people understand how to facilitate a telehealth appointment. Our series included 2 videos for individuals receiving services, an introduction to the iPad for telehealth, and an overview of telehealth appointments and how those may go. A third video for healthcare providers features tips for making telehealth accessible to everyone, which is super important. The series was completed in both English and Spanish, and was funded using American Rescue Plan funds distributed through the Administration for Community Living. For reference, all videos are available on the Justice Center's website, so please go and take a look. Justice Center also does extensive training for providers. We offer many different trainings each year. At a baseline, every year we offer investigative basics for state and provider agency investigators. This is a live online training, and it's offered in 3 sessions. We receive a lot of positive feedback, regarding that training. We also offer professional boundaries training online each year. And those who take the training can receive CAS, AC, and continuing education credits for licensed social workers and psychiatrists. Again, we've received a lot of positive feedback on this training as well, and it's something we're very proud of. Next to here, we have prevention toolkits on our website available. And each year, Justice Center develops prevention toolkits for provider agencies to help them prevent incidents of abuse and neglect. We don't just want to respond, to allegations of abuse and neglect that we get here. We also want to help prevent them from occurring in the first place. The toolkits are based on incidents reported to the Justice Center and include best practices and case-based scenarios titled, "Could this happen in your program?" That can be used for staff training and discussion. Last year we developed a toolkit on best practices for effective medical care, which provide best practices for agencies with nursing supports and for those without nursing supports. Our second toolkit developed, concerns preventing and responding to food choking incidents. we realize that food choking incidents are a serious matter, and that, according to the National Safety Council, choking on food or other objects is the fourth leading cause of accidental injury or death in the U.S. Getting back to our code of conduct trainings, we really believe that, the code of conduct that staff sign each year is one of the most powerful prevention tools that we have. If people read the code and take it to heart, to help promote reading of, and adoption of the code, we partnered with the National Alliance of Direct Support Professionals, who've been great partners for us, to provide train the trainer training so provider agencies can help bring the code of conduct to life in their agency. We also offer online interactive training for staff to take when they sign the code of conduct. This can also be found on our website. Now we'd like to discuss, Justice Center
Wait,
priorities.
Rob, I'm
Yes.
sorry. There's just been a couple questions and suggestions that have come in. So I
Okay.
just want to thank the people who've asked about, neglect is a broad category. Have we ever considered breaking it out into different categories? And we do that on occasion. Honestly, I can't remember if we do it in our monthly reports. We publish monthly and annual reports on our website every year. And it shows, a more detailed breakdown of our data, but we will certainly take that into consideration. But there was also a question of whether or not we notify not just family members, but what if someone is in foster care, for example, and so they're in the custody of the county social services department. In those instances, we are notifying the county social services department about the outcome of the case, because they are like family in that case. They are the personal representative. And that's it for right now, Rob.
Thank you, Devin. Appreciate it. And just so everyone knows, in terms of, usability of the data that we have here is a high priority for us, and we are constantly looking, to improve on the way, to improve the data that we have here and the way that we use it. So in terms of priorities for 2024, reducing case cycle time, a perennial issue is our number one operational priority. We really want to reduce the amount of time it takes to complete an investigation. We understand the disruptions that an investigation can cause, especially, if an individual is placed on administrative leave. So we continue to work very hard to ensure that we have the resources we need to complete and review investigations and make legal determinations in the fastest amount of time possible. The labor shortage right now, the workforce crisis, makes this an even more critical priority for the Justice Center here, because we understand the downstream impacts of that longer investigations, have on provider agencies and the care that individuals are receiving. Just for reference, we mentioned earlier that we received about 85,000 reports this past year. When the Justice Center started, the number of reports that we were estimated to take annually was only 40,000. And in years previous, it has been upwards of 100,000. So we have really been playing catch up here ever since. We've done a great job. We know we want to do better, but this has been an uphill climb for us. We have made tremendous progress. This is still a priority for us and always will be. We just want you to know that everybody who attends this session is going to be receiving a list of our statewide regional supervising investigators. These are the folks, they are a great place to start if you are a provider and have questions about the status of a JC investigation. They're also a great place to start, to establish a relationship with, key staff at our agency. So we encourage you to use that list when you receive it after this, as a place to establish a relationship and have your questions answered. Next here, we have our staff exclusion list. As you can see, individuals on the list are prohibited from being hired by any state-operated, certified, or licensed agency or provider that serves people with special needs. Prior to the Justice Center, there was no effective way to keep staff who had committed serious intentional acts of abuse, like sexual or serious physical abuse with intent to harm, from working in another provider agency. There was shuffling of individuals between programs and between providers, which was not a good situation for anybody. Now that we have the staff exclusion list, provider agencies are required to check that prior to hiring somebody. Placement on the list is permanent once you are on there. Since 2014, we have placed over 900 individuals on the staff exclusion list, and there have been over 300 times when an individual placed on the list attempted to get another job at a different provider agency, and they were unsuccessful because of the list and the required check. Again, in terms of prevention, we view this as another really important piece of our prevention work by stopping individuals with a history of abuse from working in the programs and agencies that we oversee. Next piece here is supporting the workforce, the dedicated people who come to work every day to do the important jobs they do. Just want to let everyone know we have a ton of resources available on our website that help explain our processes, like what to expect during an investigation and how to appeal. I can't emphasize enough, and encourage you to go to our website, to look around, look at all the different resources we have there. We've worked really hard to build that up, and we want you all to take advantage of it. In terms of prevention resources.
Wait, I got a couple questions for you, Rob.
Okay.
So on the cycle time slide, and this was our bad, someone asked, what does an SOA-led investigation mean?
Okay. We have, the Justice Center, there are roughly 11,000 or so abuse and neglect investigations that happen statewide annually. The Justice Center conducts roughly half of those on its own. The remainder are delegated out, for investigation by either one of our state oversight agency partners or directly to the provider where the alleged incident occurred. Every delegated investigation that occurs outside of the Justice Center comes back to the Justice Center for quality review, and then also ultimately the legal determination that is attached to the case. So while we do not have the resources here to investigate every allegation that rises to abuse and neglect that we see, those that are delegated out do come back through this agency, and the legal determination on all abuse and neglect investigations is made by the Justice Center.
Thank you, Rob. The next question was, I think someone said, I may not have been paying attention, but are the number of reports that we've been receiving since the Justice Center, have they been increasing, or was the distinction, you were making the distinction that we were expecting half the reports before we went live? Yes, right. So
yes.
We've been, generally our number of reports received have been pretty steady. There was, throughout the years, so it hasn't been a big change. Are public schools under the Justice Center's jurisdictions, should someone report an incident to the Justice Center if it occurs in a public school? They are not under our jurisdiction, public schools. It's only residential schools that serve, it's typically residential schools where children are placed, or children or people with disabilities. So it is not all public schools. You can always call the Justice Center about any allegation of abuse and neglect. And if we don't have jurisdiction, we'll make sure it gets to the right place. There was a question that asked if we would ever consider adding financial exploitation to the list of things that can put someone on the staff exclusion list. That is not something that the Justice Center has control over. That is people who end up on the staff exclusion list, and the reasons that they are on the the allegations and things that they commit, they're put on there because of what the law allows them to be on the staff exclusion list. And that is not one of the areas that is currently in the law. So that's why we do that. And there was one final question about if we have any indication data about how often incidents are upgraded from significant incident to abuse. And it does happen. We have in previous presentations, we've talked about our 3 business day review, that, we'll look at cases and, sometimes we will drop things that may have looked like abuse and neglect down to a significant incident. But I don't think we have that specific. And that's it. So keep on going, Rob.
Okay, thank you. On to prevention resources. Again, we take our prevention responsibilities and our partnership with everyone very seriously. Again, please check out our website. On our website, we have Spotlight on Prevention. One of the first resources we developed was the agency self-assessments. These assessments allow for agencies to complete self-assessment of their program to see why they may be vulnerable for incidents of abuse and neglect, and guides agencies in ways to address those areas. We have best practices for an abuse-free environment, and we have already talked about how important we believe the code of conduct is. So please check out our Spotlight on Prevention resources. We also have prevention toolkits. These are all the different toolkits we have developed so far. Resources are intended to be used as a guide that may be modified as needed, for different providers based on their specific circumstances. Each toolkit, as we mentioned before, includes a section called "Could this happen in your program?" Which provides scenarios for staff to discuss and identify ways to prevent particular incidents, from occurring. As you see here, dangers of being left behind in unattended vehicles, medical emergencies, reducing use of restraints, properly securing wheelchairs in vehicles, dangers of intestinal obstructions. All of these are really, really good, well-researched, prevention toolkits that, again, we encourage you to check out on our website. Next is our prevention blog. Last year, we developed this blog that you can subscribe to on our website, and you will get updates on our prevention tools, and you can go on, the website to see the blogs that highlight prevention tools that are needed to help, people live self-directed, meaningful lives free of abuse. Next is community resources. I can just, in the next section, I'll describe some of the programs supported by the JC that help people with disabilities and special needs thrive in the community. First is our trade program. I have on my notes, one of the best kept secrets in New York State. It's not a lie. This is a great program. We've done tremendous things with this program over the years. TRADE does stand for Technology Related Assistance for Individuals with Disabilities. It provides access to assistive technology to any New Yorker with a disability through 12 regional trade centers that are scattered statewide. These centers provide device loans and hands-on training to help people with disabilities. You can find the names and locations of the trade centers on our website. If an individual needs a device, they will loan these out to them if they need it for longer than 60 days. Trade staff can provide them with a long-term loan. Trade receives donated devices for members in the community. They clean these, they get them ready, to be reissued to individuals who need long-term care. I can tell you again that I have personally visited some of our trade sites and centers across the state. They do tremendous work. Again, encourage you to look into the program and certainly utilize the services. Melinda Dolezal, who is our head of trade here, she is active in the community, giving presentations, working with external partners here. She does a fantastic job, and we thank her for everything that she does. I'm still trying to get to coordinate a presentation at my children's school on this program, which I think will be a big hit. Next are the disability resources we have. Our website contains info about disability related programs, services, laws, and regulations. Justice Center provides links to resources from local, state, federal, and national agencies, as well as nonprofit organizations. We want to provide a wide range of information that can be helpful to people with disabilities, their families, caregivers, and advocates. Again, I encourage you to please go check this out. Next thing we want to talk about is our surrogate decision-making committee program. Again, a program outside of, abuse and neglect or incident management here, but a super important, program that we have that provides individuals who lack the capacity to provide informed consent for medical decisions and who do not have a designated representative to do so. These decisions can include end-of-life care. SDMC volunteers, a very dedicated group of people, who are willing to put their time into a really critical piece of what we do here. They serve on panels across the state on an as-needed basis. They're specifically trained to review situations submitted by physicians on a case-by-case basis and render a decision on medical needs. The service is offered free of charge to all New York State residents. Again, more information about the program can be found on our website. In terms of contact information, how can you get a hold of us? There's many ways you can contact us. So, report abuse and neglect. We have our phone number up there. Information and referral services. Please call us. Individual and family support that we mentioned before. They also want you to call them.
Yeah.
They want to help. And then other questions, you can see our general agency number. I can tell you that occasionally I get those right to my phone because my number is very close to that. But, with that said, thank you so much for the opportunity, to give you some updates on, our priorities for the current year and the resources we have available to you. Thank you so much for the opportunity to talk to you.
Hey, Rob, we just had a couple questions. So I wanted to, one of them was someone asked if category 3 findings are tracked in any way for people. So just to clarify, when the legislature created the Justice Center and created the different categories of abuse and neglect, it was in recognition of that there's a variation in abuse and neglect. And sometimes when something occurs and it's not serious in nature, do we always need to get rid of the staff? Can we retrain the staff? We leave those decisions up to you, up to the provider agencies, because they know the staff, they know their population. Sometimes provider agencies, if someone is unsubstantiated, that doesn't make a difference. The person may have violated a very important policy or procedure of the agency. They make the decision about what happens to a staff person, but the law does not permit that there be tracking of those people, that we can't share information with future employers about category 3 findings. And you can find out more information about that on our website. And someone asked if the regional contact map on the website can be shared again. We're sending out to you, because you're attending this, the list of all our supervising investigators by region and by county. So you should be able to get in contact with whoever it is that you need to for these things. And we'll just give it a minute or two in case somebody has another question while we have Rob with us. But we do thank you for attending. And please fill out your evaluation when you get it, because that's really important to us for next year as we develop these. And I'm not seeing any questions come in. We appreciate the emoji love.
And I was gonna say, I see these floating thumbs and hands on the side of my screen.
Our family court findings or cases investigated are part of the the review process. Family court is not under our jurisdiction. Family-based foster care, also not under our jurisdiction. So they are not investigated or part of our review process. If you want to access Zoom from this morning, contact that'll be the Zoom that we had this morning will be posted on our website in early May with all the other sessions. So I think that's it. So visit our website and call the 549-0200 number if Rob talked too fast and you have a specific question for him. Thank you.
I'll talk to you on the phone soon. Thanks, everybody.
Thank you all. Have a good day.